Hello, I am Dr. Jennifer Mieres, Professor of Cardiology at the Zucker School of Medicine and Associate Dean of Faculty Affairs. I have the distinct honor of also serving as the inaugural Chief Diversity and Inclusion Officer at Northwell Health. 2010, Northwell Health formalized its approach to diversity, inclusion, and health equity. We established a strategic plan and launched an Office of Diversity, Inclusion, and Health Literacy at that time. And why was this important? Important for us because we were launching a new medical school and admitting the first class, the inaugural class, to the Zucker School of Medicine in 2010. And starting a new medical school, as Dean Smith would say, was the perfect opportunity to take stock and take a look at the patients we were serving and take a look at our healthcare delivery model. So who are we at Northwell Health and why was this important? Well, you can see here, we are 23 hospitals. We have 75,000 employees and we serve about 8 million patients. And you look at the footprint of Northwell Health and you can see the diversity of patients and areas. We serve a population that has a preferred language other than English, close to 40%. So 40% of our population has a preferred language other than English. And as you know, in healthcare, how you communicate is truly important. We did the American Medical Association's Sea Change survey. We did a snapshot at 4 of our hospitals and benchmark against about 54 hospitals and health systems in the United States against these different domains. You can see here as highlighted in the red arrow that our language services was definitely in need of severe attention. And based on the results from the AMA survey, as well as feedback that we got from many of our team members and community members, we turned our focus internally to build a strategy to educate our team members at all levels, the clinical team, the non-clinical team, the administrative team, to truly foster an environment of inclusion and integrate the tenets of diversity, inclusion as into part of the Northwell DMA. So we established the Center for Equity of Care, and you can see in 2017, and you can see here our mission to advance the delivery of culturally inclusive healthcare and effective communication in partnership with our communities to achieve health equity. And aligning all of our healthcare teams and communities to truly address all aspects of healthcare disparities. You can see here our strategic pillars, the Center for Equity of Care. This was foundational to the implementation strategy. We have the pillar of leadership commitment because how you're getting your governance structure is important. Having your CEO, CFO, CEO, deans, CMO, all as part of your governance structure for anything related to diversity, inclusion, and health equity is of paramount importance. Our education and development pillar are working in partnership with our corporate university, CLI, Dr. Kathy Gallo and her team, truly expanding to do case-based and simulation in teaching our entire workforce at all levels, customized to truly be culturally competent, culturally aware, and truly build trust. And the importance of understanding someone's culture, understanding the impact of unconscious bias and implicit bias in healthcare delivery, it continues to be a work in progress. Or language access, and we'll come to that in a short while, was a huge area of focus. Community partnership pillar, which we'll talk about, which truly got activated with COVID, served to help us advance and enhance or strategy towards health equity. So this is our strategic sort of foundational pillars that everything is based on. And we added allyship because we have a lot of strategic partners recognizing that it truly takes a village and that many aspects, many areas on the healthcare team, on departments, institutes needed to be involved and committed to embedding the tenets of diversity, inclusion, health equity into the day-to-day operation. You can see here what our leadership commitment pillar looks like. As mentioned, our executive council, which reports in to our board of trustees. And so here you see, as we move forward, we have made that national commitment to these 4 areas, the equity of care pledge. And I would say that you could see here that our workforce, that pillar, our workforce pillar, and getting our business employee resource groups, which are or BERGs or ERGs, where our employees volunteer and join these different groups. Our employees have been instrumental at all levels in truly helping us build trust internally with our internal community, as well as externally. A lot of our employees live in our communities. Let's take 2 minutes to take a look at language access, because this was an important area for us. How you communicate with patients, especially in times of illness, is of most importance. And as we think of the Institute of Medicine's sort of mandate for us to expand our healthcare delivery model to deal with the epidemic of chronic diseases, we know that communication and trust are really important. And so recognizing that 40% has a preferred language other than English, truly expanding our entire language access services was of definite importance. We have expanded to include video remote interpretation. We have customized care based on the catchment area of a hospital, understanding the demographics. And one of our hospitals is in Queens, truly where there are about 177 different languages, dialects spoken. And we have partnered with our community to meet their language and communication needs. So a path forward is definitely one of linking equity to quality, embedding it into everything we do that is related to healthcare delivery, and truly now focusing and amplifying our community partnership pillar and truly establishing a focus on community health equity. We go back to our national commitment. And so as you think of of how you identify and evaluate healthcare delivery and to sort of assess or evaluate whether there are healthcare delivery disparities, one important component, as highlighted on the Equity of Care Pledge, is are we accurately collecting race, ethnicity, preferred language? Are we understanding what our communication needs are of our community? We have now established a dashboard where we can tell by zip code where our patients are coming from, what their race, ethnicity, preferred language. We can tell the top ICD codes, and we are now in the early stages of using this data, to look for healthcare delivery disparities. We are also continuing to educate and to partner with our communities to let them know that this information, when you come into a Northwell facility, sharing your race, ethnicity, or preferred language is absolute importance for us to customize care and meet your healthcare needs. You fast forward to 2020, a year like no other, a surreal year, and truly our work laid the foundation and to help us truly build that community partnership. And the importance of community trust came into full view and became apparent with COVID-19. So you think of Northwell Health System, 23 hospitals in New York State, placing us truly at the epicenter of the COVID epidemic. And so we were fortunate in that many of our employees and our employee resource groups were able to help us build the much needed trust with our communities. We partnered quickly with over 100 faith-based organizations. We partnered with our FQHCs and our community-based organizations to do COVID testing, and then fast forward to delivering vaccines. And so this led to the formation, truly, of a coalition that helped advise or path forward with community partnership and laid the groundwork for community health equity. So you see here, it brings us back to the AAMC's sort of visual analysis that the community really is foundational to the journey to health equity. And so COVID and our partnership with our community led us at Northwell to expand and redesign our approach to truly diversity, inclusion, health equity, and community health equity, led by community health, population health expert, Dr. Deb Salas-Lopez. And you can see here, bringing together the Center for Equity of Care, community partnerships, and community relations and community health to move forward. Because of COVID-19 and our partnership with faith-based organizations, community-based organizations, and community members, we've established a health equity task force that will stay in progress and will continue as we move forward on the journey to achieving health equity, but community health equity. And here you see our new plan moving forward, community health equity, truly right care, right time, and right place. As our tagline, and our tagline is raising health. You cannot do it without the trust and partnership of our community. And after several hundred listening tours with Dr. Deb Salas-Lopez, Reverend Barbara Felker, member of our team, listening to the communities, listening to input from our health equity task force, we've sort of landed on the fact that our strategy moving forward will focus on community education, economic vitality, neighborhood and physical environment, as well as a focus on health and healthcare disparities. And we will continue to truly educate and make sure that all of the tenets to achieve health equity are truly baked into the fabric of Northwell Health and the way we deliver healthcare. And it started with data collection. It started with truly building a structure and a strategic plan based on and having the resources, leadership commitment, using the entire workforce under the umbrella of employee resource groups to help guide our strategies, and then truly getting down to the data and collecting the data and building a true partnership and trust with our communities, because healthcare definitely is a team sport. Communication is definitely important. And it's great that in the space of diversity, inclusion, and health equity, there's such great collaboration. No need to reinvent the wheel. And I know that Dr. Deb Salas-Lopez is putting together a huge sort of national coalition that will help us refine and expand our community health equity strategy. And so, ladies and gentlemen, hopefully this has given you just a snapshot of what we've done at Northwell Health for the past 11 years. The journey continues, and I thank you very much for your attention. Trust with your communities, with your team members of paramount importance on the journey to health equity. Thank you.